Let me just start by saying that data is extremely important to guide decision. So when it comes to data collection, I believe the first thing to do is to really get a data collection tool, train those who will be collecting the data by explaining to them the rationale for collecting that data. Why are they collecting that? The use of that data. Once that is done, it makes it easy to use the data for public health actions. So if I give the example of meningitis, usually when you have an outbreak of meningitis, countries will be collecting the data because it's extremely important for them to get that data, share it with WHO so that vaccine can be made available to those countries, and then the response to the outbreak of meningitis can start. So that's one of the practical example of collecting the data for decision making at national level. It's one thing to collect the data, it's another one to use the data. So what we've been doing over the past few years was really to closely work with countries to ensure that they know why they are collecting the data, and then using that data, analyzing it, and then making sure that it can lead to decision making. One of the examples is really the use of data during outbreaks of Ebola. Usually, countries will deploy teams in the field to conduct field investigation, and from that field investigation, we will know whether or not there's an outbreak of Ebola. If it's laboratory confirmed, then specific public health measures will be put in place to support the response. So that's one of the examples of using the data to guide a response to an outbreak such as Ebola. I strongly believe that graph network is one of the tools that will somehow change the way we've been using collecting and using the data, because one of the key features of graph network is really to bring not only just epidemiological data, but a broad variety of data into one platform, which helps you get a full picture of what is happening in a given country and then help you make decisions. So moving forward, I strongly believe that as WHO, we'll be closely working with the University of Geneva and Graph Network members to ensure that we use that tool at country level and support the day-to-day response to ongoing outbreaks, but also other public health priorities, so as to save the many lives in our region. So that's where I see the graph network bringing expertise. The other area which is extremely important and which was discussed during this meeting is really the capacity building on data analytics. So I also think that the experience gained by graph over the past 2 years will be extremely important in strengthening the capacity of countries in data analytics. And if we can have this expertise in the field, that will help us make better decisions with the hope of having better outcome.